This film will take you through the benefits of breastfeeding, the science of breast milk, feeding methods, some common problems and tips on how to solve them. The nutrition your child gets in the earlier years affects her health forever, and it all starts with mother's milk. Benefits for your baby. Mother's milk is easy to digest, offers protection, builds tolerance and strengthens the bond between you and your baby. Benefits for you. Breastfeeding helps you get back into shape quickly, reduces the risk of breast cancer, ovarian cancer and osteoporosis later in life. Science of breast milk. During the first few days after delivery, a yellowish fluid called colostrum gets secreted from the breasts. This fluid is full of proteins, vitamins, minerals and protective nutrients that builds your baby's protection for life. Then comes transitional milk, wherein the protective nutrients and protein decreases while fat and sugar content increases. Mature milk increases in quantity and contains more fats and proteins. How to breastfeed? Begin by getting in a comfortable position. Use pillows to support your back and arm. Place your baby with her whole body facing you and her head in the crook of your elbow. Nudge her a little so that she opens her mouth wide and places it covering your nipple. See that your nipple is on top of your baby's tongue. When she begins to suck, make sure she takes enough of your nipple and areola in her mouth to properly latch on. She may fall asleep after a few sips, so give close attention to her movements. How to hold your baby while feeding. Cradle hold. Sit upright and place your baby on her side across your lap facing you. Support her head, back and bottom with your arm and move her face near your breast. Football hold. Hold her head and neck in your hand. Let her feet extend towards your back. Support your arm with a pillow and direct the baby's mouth to your breast with the other hand. If you have had a cesarean delivery, have large breasts, or if you are nursing twins, this position might be better for you. Side-lying position. Lie on your side with your baby on her side facing you. Position her head at your lower breast. When she has attached to your breast, use your lower arm to support your head. Experts suggest this position if you've had a cesarean delivery. Burping the baby. Your baby may swallow small amounts of air during feeding. To release the air, place her over your shoulder and gently pat or rub her on the back till she lets out a burp. Tips to tackle common breastfeeding issues. Leaking milk. Sometimes milk leaks as a normal physical reaction right before nursing or when the baby cries. Manage this by using absorbent nursing pads inside your bra and change it often. Sore nipples. If your baby is sucking too hard or latching incorrectly, it might cause sore or cracked nipples. Try a new position. Air dry your nipples after feeding or showering. And rub your own milk around the nipples. Breast pain. If you experience tingling only when your baby is nursing, it's a normal sign of your body releasing milk. But if your breast is sore or hot or you have a fever over 100 Fahrenheit, you may have a breast infection. Talk to your doctor immediately. Slow milk ejection reflex. Before your baby begins to nurse, gently massage your breast for stimulation. It's important to stay calm and relaxed. Plugged ducts. Sometimes a small, hard lump may form in your breast. Start nursing with that breast first and encourage your baby to nurse longer on that side. Apply a warm, wet cloth before feeding and massage the area from time to time. Engorged breasts. As your breasts adjust to her needs, gathering of milk in your breasts may cause them to become painful, hard and swollen. Try a new position and feed your baby frequently. Push out a little milk if your breast is too full for her to latch on properly. Place a warm, wet cloth on your breasts to soften and ease the pain. Breastfeeding Basics is brought to you by Nestle Start Healthy, Stay Healthy. Nestle Start Healthy, Stay Healthy is an educational initiative in partnership with doctors that aims to make good nutrition a way of life and create a healthier generation. We owe it to our children.